Are some of you struggling trying to keep up with your health while racking up a lot of bills? Basically, you're trying to heal with all the bills. You're trying to get your ears back in check, but every time you go and see someone, about 2 or 3 weeks later, boom, another bill shows up in your mailbox. Well, I can tell you I was in this position and it was starting to get incredibly frustrating. It was like I was going in to get help doing the responsible thing for my body and my health, and then I would turn around and get this bill that I didn't know where it came from or who it came from. Well, in this video, I'm going to explain why this might be your case and what you can do about it to prevent this, or if you're already in it, hopefully prevent future damage to your bank account. And I want to be that stepping stone that's going to help you get over this hump that you're going through. Nothing worse than trying to heal with something, regardless if it's your ears, you have a bad back, you suffer with sinus issues, or whatever your problem may be, or the case that you may be dealing with. It's not going to be very easy. Every time you turn around, you owe someone something. And what makes it worse is when you receive the statement in the mail, you don't know who it is. You're wondering, what the heck is this? I didn't go and see this person. I'm going to lay all that out for you. I spent 3 years studying health insurance. And honestly, I wouldn't say that it was a blessing and a curse at the same time. I almost think that a lot of my problems that I had with my ears came from when I worked for this company because of a multitude of things. Now, I was very fortunate to work for a company that did provide me health insurance, because a lot of you out there probably are struggling to even find that or even have that. So I did have a company that provided me a good health insurance and whatnot. But at the same time, I was dealing with my ear problems and it was just racking up my bills every time. So basically, some of you right now who are enrolled in a plan, you're either enrolled in an HMO or a PPO plan. Now, depending on that plan, you can either have a plan that's predominantly, when you lay out the general benefits, it's going to be predominantly copay. So like if you go in to see, you go into the emergency room, you're going to pay a set copay, and that's a negotiated rate based on wherever you live. So you're either going to pay a set copay with the emergency room, your general practitioner. A lot of you are offered, some plans offer a wellness visit, like a free wellness visit. So you may just go in and pay a copay and then the rest of that visit should be covered. Well, I had a PPO plan. So basically most of my plan was copay based, I would say more heavily copay based. So my emergency visits, I did have a line increment for specialty visits, and I'm going to get into what all this means and what you might be enrolled in. Well, the first year I was enrolled in an HMO plan, which that plan allowed me to go see all these different providers. But the caveat of that was I was going to be responsible for the deductible up front. So regardless if I saw my general practitioner or outside of my wellness visit. So wellness is something that's preventative. So you go in each time and prevent yourself from further problems. That's considered preventative. Most plans cover that. If they do not, you might want to recheck with whoever your employer is and see about getting adjusted or get into a plan that fits better for your needs. But overall, let me just finish this story here. So I was in an HMO plan and it did cover those preventative visits. However, it did state that I needed to meet my deductible. My deductible was $2,500, and that needed to be met prior to anything being covered or the full visit being covered. So when I went in to see going flashback, let's see, 2000, I want to say 16, when I was really in the deep struggle with my ears, I went in to see an allergist, which in my plan was considered a specialist. And let me tell you something. I went in thinking, okay, this is probably just going to be, because most of the time, a lot of you think you just go and pay that copay. Well, I wasn't inclined to health insurance, even working with health insurance at that time. Just newly in the job, I went to see a specialist, and boom, I was hit with $500 deductible because of all the things that I had to render during that visit. So if your plan is going to ask you to meet a deductible first, regardless of what you have done, you're going to be responsible for that visit if your deductible is not met. Now, some of you are smarter than I was. I ended up getting hired in this role, and right when I was hired, before I even finished any of the training, I went right away to go get my ears taken care of, and boom, I was hit with a bill. And to make matters worse, when you go in to see a specialist or you go into an allergy clinic, there's going to be a lot of providers in that clinic. Now, listen up closely. You're going to go in and you're going to be seen by, hopefully you're not going to be seen by more than one person, but let's just say you go in and you're seen by more than one person like I was. There was a person that did a render services for my ear. So I had someone do it, put a camera in my ear and look and see what was going on. And then I had a person come in and talk to me about just my overall health of my ears and whatnot. When I got back home about 3 weeks later, I got a bill from multiple people. And I'm going to explain why that might shock you, because you go in and you think, okay, I'm under this one clinic, I should just get one bill. There's a lot of providers that do services in buildings that they aren't always full-time in, and they go other places and do services in other areas. And so if they're in there at that time, they're scheduled to render a service there, and you happen to be there as well, and you need that service. If they're not in your network, I'll say this right here, your network are providers that are negotiated and contracted based on your plan to give you the best, hopefully the best outcome, the best service rate, I guess you can say, for that particular visit. Well, unfortunately, I saw someone that was considered out of network, and that provider billed me an astronomical amount of money. I'm not exactly sure the amount now, since this was quite a bit ago, but when I got home, I was like, okay, I'm still dealing with this condition. 2 weeks later, I go to my mailbox, I pull out different mail and whatever, and I pulled it up, and I was like, wow, this is crazy. I don't even understand this. And it's billed by the when you look at the letter or you look at the bill, you're not sure who it is usually, because that person isn't affiliated 100% with that clinic. They are rendering services in that clinic, so they may do their service there, but their billing may come from a different clinic. That makes sense. So basically, they're doing services there. You're basically receiving their services, but they're not in the umbrella of where your plan is. So I basically had to be responsible for that entire amount. And I looked up the name. I was like, are you kidding me? I thought this would all be covered when I walked through the door. I thought this would all be under the same umbrella. So basically, I would pay a rate. And that's one of the things that makes it tough when you're dealing with this condition. You're saying yes to everything. You don't know what to say no to or what you can hold off on. You just feel like you go in, you just need to say yeah to everything. And I want everybody to understand that some things this is the most challenging part about this particular healthcare system. I know it's different in other countries and probably a lot easier, but I want to tell all of you out there, if you're in this position and you're trying to get healed, you got to be very cautious, because you go in, especially when you go into a specialist, a clinic, an allergist, otolaryngologist, ENT doctors. You go into those clinics and you have other types of providers in there rendering services, and some of those providers aren't contracted by your plan. So you may have that service with that provider and they're not contracted. And there's nothing you can do about it once you receive that bill. I mean, you can stay on the phone and plead, but most likely you're going to end up paying that bill, especially going back to if you're in the HMO plan, you're really going to be stuck, because you're going to be paying all that into the deductible. And then once the deductible is met, then depending on your plan, you're going to pay a certain percentage based on co-insurance. And it's a whole thing after that. But just want to let all of you know out there that this is a big problem, because when you go in, and I didn't even get into really the emergency room. Some of you are probably going into the emergency room. It's pretty similar in that regard, like the specialist. You go in and there's all these different people trying to do their services. I shouldn't say people, but doctors trying to do their services and professionals trying to do their services. But unfortunately, they're not going to be cautious about if your plan covers it or not. They're just going to do their service. They're going to render their service. And regardless if your plan covers it or not, that's beyond their concern. And so you're going to go into the emergency room. You're going to do blood tests. You're going to do possibly, a scan, sometimes an MRI, X-ray, scan of the sinuses. And all these things are outlined in different ways. So like to get a camera in your sinus region and see what's going on, it could fall under a different category in your plan. It's not under preventative, obviously. It's not under anything that could be possibly covered. It can be considered imaging, which then you would need to go look at your plan and see if, how much does imaging cover. And even if so, that company that's representing that provider, or that however that provider is set up in the billing system, may or may not be covered under your plan. So you got to be really cautious about if you go into the emergency room for ETD problems or sinus related problems, because you're going to go in thinking you might just pay that copay. Some of you might have $100 copay or $50 copay for emergency room, or some of you might even have a $20 copay for emergency room. Just keep in mind it's emergency room. So when you pay that copay, don't think you're going to leave out of there just paying that copay. 2 or 3 weeks later, maybe even months later, you will possibly get something saying, okay, you owe this amount. And then you're going to be on the phone with your insurance and whatnot, trying to figure out who this is, why they're billing me, and whatnot. And I want to tell all of you out there, the reason why I even created this video, I hadn't talked about medical insurance or anything like that prior to this video. I do have background and experience in this area, but I haven't really talked about that really much, just because it can be kind of controversial. And honestly, I want to keep the focal point on healing, but having bills come in and kind of exhaust you all the time is not going to help your healing. It's just going to stress you out more. And I think a lot of you are probably in that position. I don't see a lot of you voluntarily bringing it up. So maybe you guys are okay with that area. But I'm going to tell you, I wasn't okay with that area. It was very, very troubling to be trying to heal and then trying to pay these things and pay these people off. It was beyond me to try to figure all that stuff out while struggling still inside. And that's the biggest problem that we have, at least in the US, is that when you're struggling, you don't have the energy to sit there and fight over who pays what, or how do I pay them, or who is this, or are they contracted? And then it gets so deep. It gets deeper than that, to the point where it's down to something called a procedure code. And you have a procedure code is basically that facility that you have that service in sends that code or codes to your insurance. And if your insurance doesn't cover those codes, and if it doesn't match with the system and with their system of codes, it's going to kick out, and then you're going to be responsible. They're going to kick it back out to the medical facility where you had the service done at. And if the medical services, they're going to just basically say, well, okay, your insurance isn't covered. I'm going to kick it to the patient. Now the patient's responsible. So you're in the middle between the facility and your insurance constantly, especially depending on what you go in and what you end up having done. And so this makes it very hard. It just makes it very exhausting. And nothing worse than feeling like you paid a lot into yourself and then you're still dealing with a problem. And so that's a problem for me. I'm sure it's a big problem for a lot of you as well out there. So if you're in this position where you just feel like, okay, the bills are stacking up, some of these bills you may agree with, some of them you may not. I agreed with the ones that made sense to me. Like when I would go in to see, I would go in and see, the doctor, the ENT doctor. I would pay that specialist copay. That was after I had switched to PPO. I paid my specialist copay. I think it was like, at the time, $50, and then anything, of course, additional. I was kind of aware that maybe I might end up having to pay more than that, but most of the time I kind of knew what I was, signing myself up for. I also remember going in to see an allergist, and they ended up doing, I had an allergist line increment in my insurance that covered, it was like a $45 copay. I paid it, and then they ended up doing an allergy test that ended up not being covered, so I was stuck for that. So these are just the things that we deal with, at least here in the US. Some of you maybe you don't have this problem, but for those that are watching this video and you're in this position, just know I'm here to help. I can help you figure out what's going on, how to help you. I used to be on the other side helping patients and members with this stuff too. So if you need any assistance or you have questions about what you received or what that is, I can be helpful for you as well. I was just fortunate that when I was dealing with my ear trouble, I was in the process of being certified to learn this stuff. So it was kind of like my own on-the-job training. But in my personal life, I ended up, training how to navigate all this stuff while dealing with it myself. So it was kind of like a real life lesson for me. But anyways, I hope this video was very helpful for all of you. If it was, please take time to subscribe to the channel. I try to bring content pretty often. But in the meantime, I'm going to step out of the Jaye Wellness Studio and leave you in good hands with this video. Like anything else, folks, we are here to simply go back to the basics. Take care, everybody.